looking at med school versus vet school. And the biggest thing that kind of drew me in is that I wanted to be a voice for a patient that didn't have a voice. And so right from when we were real young, um, he had us building things down in the shop. And so we all to this day love to woodwork. And so I think that's actually, orthopedics is, very hands-on, very woodworking like. And so,
Yeah.
I've got, I call it a disease. I can't leave work unless everything is finished. All biopsies are called, all owners are called, everything is tucked in.
Everyone at your practice that I've ever dealt with has been top notch. I mean, your reputation has only been increased by the people that you've surrounded yourself with. And I will tell you, the very first time, your efficiency and ability and how quick you were able to do the surgery, and it was like perfect. He said, I cannot even make a case for me doing it.
We see there's a lot of different reasons or potential pathologies, etiologies as to why these ACLs tear. Some of them are within our control. Some of them are outside of our control. But I think the baseline thing, and I think the same thing for human health is, a good diet, but staying active and staying thin and trim. But the weekend warriors, where those ligaments are resting all week, sitting on the couch, and then they go out and do crazy stuff all weekend. And I think they'll come in with the thought process of like, this is kind of a doggy surgeon. And, I think a lot of them leave like surprised that, they're using the same equipment I'm using. They're doing some similar stuff. And so I think that
Their eyes get open to how advanced it really can be.
You know, the other stereotype is the overconfidence from surgeons, and just kind of the cockiness. And I will say that surgeons, the position kind of selects for people like that, because it is something. If you can, you need someone that can be like, yeah, that dog's heart valve is faulty, I can go ahead and replace that. It's kind of crazy. You're like, but you need someone who thinks that they can do things so it somewhat selects for those type of people. But there is a good balance in there where you've got someone who's confident yet humble.
Not just, cut and paste things together and you have to also keep some internal medicine brain. One of my clients he's a wonderful human surgeon, but he's basically, he's in the surgery, and then once that case moves out of his surgery suite, someone else does all the other stuff. And I would think in the veterinary world, you still have to keep your fingers in the medicine side a bit too. You can't completely cut it off, which is better for your
100%.
brain, maybe.
No, it's
But
100% true. It's I will say that when I talk with my brothers, we're having conversations about things, and they're giving some advice to my parents, and sometimes I'll just be like, "Hang on," it's like, so.
yeah.
But yeah, no, definitely you have to. I think it's. I wouldn't necessarily say it was brain power. I think we were taught work ethic pretty young. We heated our house by wood, and so it was when we grew up, and so it was work ethic. I think that my dad really, and so we worked through the lack of brains by sweat. That sounds good. And if I can say one more thing, I do think that it's guys like you and Amat that, I do a lot of driving because I live about an hour and a half away from Charlotte area, and we still live there. But my intent initially was to go back into the region that I was. But what kept me on the road and doing mobile up in the Charlotte area, where the quality of veterinarians and teams that I was able to work with on mobile. And so that is something that I thank you guys for creating that environment on there. So it's definitely enriched my life through all of this.